This is an anterior view of a knee, otherwise known as the tibial-femoral joint. In this model, all the muscles have been removed so that we can see just the ligaments that are part of the knee. The first ligament here is on the anterior of the knee. Underneath here is the patella, so this is the patellar ligament. You could also refer to this as the patellar tendon. On either side of the knee, you will have the collateral ligaments. On this side, where you find the fibula, you will find the fibular collateral, otherwise known as the lateral collateral ligament. And on this side, you will find the tibial collateral, otherwise known as the medial collateral ligament. On this anterior view, you can also see the meniscus. Here is the medial meniscus, the fibrocartilage pad that is found on the superior surface of the tibia. And over here, you'll see the lateral meniscus. If we turn the model over, you will see the posterior cruciate ligament in the back. To see the anterior cruciate ligament, we will reflect the patella out of the way and flex the knee slightly, and now you can see the anterior cruciate ligament and the inside of the knee. Here is a hip joint, otherwise known as a coxial joint. The ligaments in the hip joint are named for their two attachment points. So if you know the bones in the hip joint, you should be able to name the ligaments. Now remember, the os coxa has three separate bones that have fused together. Remember, this is the ilium, this here is the pubis, and in the posterior here, this is going to be the ischium. So, the ligaments that start at the ilium and go to the femur are called the iliofemoral ligaments. The ones that start at the pubis here and go to the femur are the pubal-femoral. If we turn the joint over and look at the back where we have the ischium here, the ones going from the ischium to the femur are the ischiofemoral. This is a model of the shoulder, otherwise known as the glenohumeral joint. Again, the ligaments in the glenohumeral joint are named for their attachment points. So if you know the names of the bones or the names of the projections of the bones, you should be able to identify the ligaments. The first of our ligaments is this one that starts on the coracoid process, back here on the coracoid process, and goes underneath this ligament and attaches to the humerus. This is called the coracohumeral ligament. Next is the one that goes from the acromion process here to the clavicle. This is called the acromioclavicular ligament. There's also a ligament that goes from the coracoid process to the acromion process. This is the coracoacromial ligament. And then we have multiple ligaments that goes from the glenoid cavity to the humerus. So this ligament here, this ligament here, and this ligament here are all called glenohumeral ligaments.